Tribulus Terrestris and Ashwagandha, two supplements that are talked about all the time in terms of erectile dysfunction, but do they actually work? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today I'm going to cover the science behind Tribulus and Ashwagandha, and do they actually help improve erections? Tribulus terrestris. Now, this is an herbal plant that's seen in parts of Greece, China, and India, and it's made of bioactive components called saponins and tannins. And saponins are known to increase nitric oxide activity that we talked about earlier. It may also potentially increase testosterone levels, and I made a video about that as well. That's coming up soon, as well as increase DHEA sulfate levels, and maybe has some PDE5 inhibitor activity as well. So while it's shown some benefit in rat models, in human studies, there's a randomized controlled trial that showed actually no improvement in erectile function or IIEF scores when compared to placebo. After that, there was 3 randomized controlled trials ranging from 1 to 3 months in duration and had about 272 patients total, with 136 receiving Tribulus and 136 in the control group. And in these, they saw a significant improvement in erectile function with a mean difference of 3.88 points. And the minimally effective dose was 750 milligrams daily. Now, again, the risk of bias in these studies is high. It was about calculated at 50%. The other important thing to know is that there have been side effects that are concerning with Tribulus, including renal failure or kidney failure and liver failure. So ultimately, I would say that given the risk of these sort of serious side effects and the potentially conflicting data, I would not recommend it for erectile dysfunction. Next up is ashwagandha. So ashwagandha, also known as Withania somnifera, is an herb, and it grows in India, Middle East, parts of Africa. It's often used in Ayurvedic medicine for stress and immune support and to reduce anxiety and depression. Now, how does it work exactly? Well, it contains active compounds called withanolides, and these are believed to have a variety of health benefits and are thought to potentially have anti-inflammatory, antioxidant properties, which can help reduce oxidative stress and inflammation in the body. Additionally, it's also classified as an adaptogen, meaning that it can help the body cope with stress more effectively. So there have been 2 randomized controlled trials with about 66 patients receiving ashwagandha. Generally, they found no significant difference for erectile function in men with all types of erectile dysfunction that they did in one study. In the other study, they looked at men who only had psychogenic erectile dysfunction. And these men saw an improvement, but they also saw an improvement in the placebo group. And this is sort of telling, right? Because your brain is super powerful. So if you think something is going to help you, even a placebo can help you. And that's why you need to have randomized controlled trials. Now, there are, again, some notable side effects, potentially dizziness, sleepiness, headache, nausea, GI upset, and rare cases of liver injury. And then I guess because it sort of tries to limit your cortisol production, some people will have emotional blunting or have difficulty feeling pleasure in normal activities that they used to enjoy. You want to be careful using it with anti-anxiolytics as well as blood pressure medications, and avoid it if you're immunosuppressed, type 1 diabetic, have thyroid disease, or are on blood thinners or have a bleeding disorder. It's also considered a nightshade plant. So if you're allergic to that category of plants, which would be things like tomatoes, eggplants, potatoes, and peppers, you want to avoid this one. Hope you guys enjoyed this episode. If you did, make sure to subscribe and share this channel with your friends. And as always, you want to take care of yourself because you're worth it.